Authorities there are worried that COVID-19 could spread into Indigenous communities after a man tested positive on Sunday. Live now to Matt Cunningham in Darwin. Matt, there's particular concern around this man's visit to a supermarket in Katherine.
That's right, Laura. This is the man, aged in his 30s, who came here to Darwin first after being in the United States. He's an American man. He spent 2 weeks in quarantine in Sydney and flew to Darwin via Canberra last Thursday. Now, on Sunday, he undertook a mandatory COVID test in Darwin, then travelled to Katherine. On Sunday night, that test came back positive. That's what sent the Greater Darwin and Katherine regions into lockdown. But as you say, particular concern about that visit to the Katherine Woolworths between 12:30 and 1 p.m. on Sunday. That's a supermarket used not just by people in the town of Katherine, but by many people who come in from surrounding Aboriginal communities. There's also some concern about the potential fear around COVID and how people might react to that. Ken Wyatt, the Minister for Indigenous Australians, spoke on Sky News Regional this morning, and he said there was some concern that those people might retreat to their homelands and then not come into the major centres to get the medical treatment they may require.
The National Indigenous Australian Agency and my staff within the Territory are working very closely with the Northern Territory Health Services. In that region, there are small homeland communities, and people, if they're fearful, will go back to them and will remain isolated there and not accessing health services.
Matt, we've seen the vaccine rollout amongst Indigenous Australians lag behind the rest of the population. Why is that?
Well, it's interesting. There have been some issues here in the Northern Territory. There were issues at the beginning of the rollout, particularly because AstraZeneca was the vaccine that had been chosen in remote Indigenous communities. And then almost immediately after that vaccine begun to be rolled out, we saw those reports emerge of some of those blood clotting issues. And then suddenly there was a huge amount of vaccine hesitancy, people basically refusing to take that vaccine. It's since been replaced with the Pfizer vaccine, and we have since seen an improvement in the vaccination rates among Indigenous people, particularly here in the Northern Territory. But around the country, in some states, we're seeing the vaccination rate for Indigenous Australians be incredibly low, just 4% in Western Australia, and Victoria the only state where Indigenous Australians are ahead of their non-Indigenous counterparts. Ken Wyatt also spoke about some of those issues this morning.
People have become fearful because of what they've read, what they're reading on social media. But thankfully, we're seeing that turn around. We're seeing a stepping up by individuals, but particularly by Aboriginal community-controlled health organisations who are saying to people, get your vaccination, protect yourself.
Meanwhile, Laura, we're now 2 days into the 3-day lockdown of the Greater Darwin and Katherine areas. We are expecting an update from the Chief Minister at around 12:30 local time. We should get a better idea then as to whether there have been any more cases and whether that lockdown will lift as planned at midday tomorrow.